I am Stephanie Mabry. I'm the Senior Principal Trainer for University Health. I have the pleasure of creating curriculum for the providers and clinical staff that take every day and go and provide the services for our community. I have the pleasure of teaching and being able to put forth and watch flourish into everyday life as they support our patients that come into our clinics. And they are able to put to life my lessons as they are protecting our community and managing chronic disease and helping with preventive health. I started my journey in healthcare when I was 15 years old. I started as a monitor tech at this hospital in Lake Charles, Memorial Hospital. I was able to work in the ICU with anesthesiologists and some of the top doctors you'll ever meet. I was able to be influenced by my mother, of course, who was a nurse, but also my aunties who were social workers and teachers and servants to others. Watching them every day give their all to others inspired me to move forward with my goals in giving health and providing care for others. I worked and I decided that in becoming a monitor tech and watching the EKG machines and monitoring heart rates, that I wanted to be a nurse too. I watch young girls come in and graduate and be mentored by doctors, and as me listening and trying to understand the verbiage, that I knew that I could do that too, that I could also be a healthcare professional. And as I worked hard and understood the requirements that it came and everything that comes with being a nurse and working in healthcare, I sit forth you today, achieving my dream. I am a registered nurse. Ever since a little girl, my mom has influenced me to want to be in healthcare. She was a nurse that took every day that she walked out that door so seriously. She loved what she did, even though she didn't start in the field. She started off working in business, trying to figure out how she could help her community with finances, and then realized that area wasn't for her. She wanted to do something that was more impactful, something that she could put her hands and feeling to it and her heart in. That wasn't just numbers, but actual heart. And she went back to school, and I watched her become a nurse. I would watch her sit in the room that became my room eventually and study with this little light and this little card table. She would have these books and these highlighters, and I myself would try to mimic her and understand the words that she was reading so that I can be like my mom. I watched her watch and do long shifts and go to work 12 hours and come home tired, but still have that beautiful smile on her face. She always kept her hair pristine because she said no matter what, when she walked into that room, she wanted that patient to know that there was somebody that was ready and willing to do what they need to do to make them feel better. Presentation is everything, she'd always say. As I became older and I started to understand that my life was meant to be a person that was a servant to others first, I realized that she had always made that impact on me. And today, as I sit here as a nurse, as a healthcare professional and as an educator, I know that I'm following in her footsteps, not over to overtake her, overachieve her, but to be something just like her. Since living in San Antonio and working with University Health and having deep rooted ties in the community, by having a family that is deep rooted in social justice and fighting for the equality of our people and our community, it does nothing but give me great honor to be able to serve our community as a registered nurse. Times have been tough, but yet they are not over. Every day I get up and I fight. Every day I get up and I walk in the footsteps of those who walked before me. My family has taken every day to fight for our rights to be able to have great health care, to have equality, to be able to be intrigued and not angry, to be able to be those nurses, to have those opportunities. And as I stand as a role model, and as I stand as a person who is not only proud to be me, I'm proud to be working for you. I want to thank my family and thank this community for believing in them so that I can be. So as I am, I want you to be. I want this generation to understand that what my family has done is only what you're going to do now. That as I go to work as a healthcare provider, as a nurse, as an educator, that as I partner with your trusted healthcare provider and University Health, that we will have a healthy community. We will combat chronic disease and get better preventive health for our community because that's what we're fighting for. I am leading by example. I'm a mother. I have 2 daughters and I have 2 sons. And I have to make sure, especially for my daughters, that I am the woman that they hope and aspire to be. I have a 15-year-old who decides that she wants to be a doctor and work in healthcare, not only because she sees me every day, but she sees that there is a need. I have an 8-year-old who's following the footsteps not only of her mother, but of her sister. She wants to play basketball. She wants to be a dentist. She wants to make sure that every person that she sees and everybody that looks like her has a beautiful smile. How can I not wake up every day and want to lead? How can I not every day want to wake up and be who they aspire to be? How can I not want to be the woman that they want to be when they look in the mirror? The choice and the path is not made by me. Their choices and their paths are going to have to be made by them. But I just want to make sure that as I go out and I serve our community, that as the work that I'm putting in for others is implanted in their heart and good for them. I want to make them proud. I want them to say that I'm their mom. And when they do it, they have a light in their eyes that cannot be dimmed. I want to give them strength that no one can take away. I want to empower them to know that no matter what the obstacle is, no matter what the goal is, that they can achieve it. I know that I'm the mom. I know that I give the lessons, but they teach me things every day. My 15-year-old Myra decided that she was going to GOF. I said, what does that mean, baby? And she says, I'm going to get over fear. And I looked her dead in the eyes and it hit me in my heart because I realized that I needed to get over fear and I didn't even know what I was fearful of. She had made a goal that she was going to get over fear because she was scared of being something or underachieving in her aspiration of being on a varsity basketball team. Now, to you, you may think that that's small and that's something that, it's not too big of a goal to have. But for a 15-year-old who is supposed to be in the 10th grade and is now a junior and has to fight every day to be better than the next person, to find something in your gut and find a saying that can get you through the day inspires me to get up every day and get over fear. Not only is she launching something that everybody is saying and everybody is doing, she's inspiring me to get over fear. Get over the fear of failure. Getting over the fear of not understanding. Getting over the fear that somebody is going to do something that is going to make me feel less than. Getting over the fear of being less than. Just understanding that fear is something that is not meant for me to have in my heart. That it doesn't live in my heart with love. It has no place in my mind. And the only thing that we're looking for is success. Thank you, baby. In living in San Antonio and having a family that is rooted in the historic San Antonio NAACP and being a member of the Hill family, having my Aunt Minnie lead me and guide me as she supported me through my trials and tribulations of understanding how do I get through this healthcare? How do I find my place? How am I going to show the diversity and equity that we so need in our community? I stand every day strong. I stand every day for her. I stand every day for my uncle, Mr. Oliver Hill Sr., who is tirelessly working for this community and working to make sure that everything that we are owed is given. So as I go out every day and I provide our service and provide support to our community in making sure that we're shortening those healthcare disparities, that we're making sure that the research and the education is given to our communities. I am the registered nurse that you want to see walking into your room. I am the healthcare educator that will give you what you need to be successful. I am your support. I am Stephanie Mabry, and my family will continue to fight for you. It was my mother's mission to always protect the little Black girl. She wanted to make sure that we understood our bodies. She wanted to make sure that we understood about pregnancy, pregnancy prevention, and how to stay safe. It was her mission to make sure that every girl had a chance to be as successful as they could, no matter what. And today, as I sit here, as the nurse, as the mother of daughters, it is my mission to now educate our community about the importance of vaccination and the misunderstanding and the devastation of COVID-19. Our community will not be left out. I feel that it's my mission to make sure that the education is brought to our community in a way that we understand it. I feel that it's my mission to make sure that all of the doubt and the fears are taken away. I feel that because of my mother and because of my aunt and because of my uncle, that I have to be that face for our community that says that it's okay to ask questions. It's okay to understand what do we need to do to be protected. And I will stand with you as I stand with our community, as I stand with my daughters, just as my mother stood with every little girl that she came in contact with. This vaccine, COVID, will not devastate our community. We will get vaccinated and we will get the things we need to stay safe. I am Stephanie Mabry. Thank you, San Antonio, for embracing me. Thank you to the community for loving me. I want you to continue to realize your dreams. And please, I want you to stay intrigued and stay healthy. We still have work to do. Bye.